Welcome to the award ceremony of the 4th Health for All Film Festival. Bienvenue à toutes et à tous. Nous avons une interprétation en français sur le site web du festival, sur le site de l'OMS. Vous pouvez voir le petit bouton pour changer de langue. Et también en español tenemos una interpretación en la página web. Sorry, I'm not good in Spanish. This is the celebration of audiovisual storytelling for health promotion. And this is a tribute to all champions of health around the world. Every year, an average of 1,000 of them submit the stories of their actions, testimonies, or concerns to the World Health Organization through our festival. And today, we'll discover 11 winning films out of 93 officially selected for this 4th edition. Since our inaugural festival in 2020, this is the first time that the ceremony happens with an in-person audience. Warm welcome to all the guests here. I hope you are ready to discover the winners. Are you? Okay. That makes a change compared to last year. Our jury is always composed of WHO senior experts joining critically acclaimed artists and activists, including Sharon Stone, who will conclude this ceremony with a strong message about many of the stories selected this year. To go through this intense program, I welcome Ricky Cage, in person with us today. Thanks a lot, Ricky, for just jumping out of a plane from India and being with us right now. How do you feel about this show? What is your key expectation?
I'm just ready for it. Let's get on with it. Let's give out some awards.
And you mentioned to me earlier when you arrived about you expect something around behavioral change.
Yes. So I believe that with all the problems that we face on our planet, whether it's environmental problems, whether it's social problems, health problems, I believe that what we need most is behavioral change and awareness. And I believe that it's up to artists and musicians and filmmakers to actually take these complex ideas and thoughts and simplify it through the emotional language of the arts. And therefore, reach out to everyone emotionally through their hearts and souls and bring about change. So I'm very, very grateful to the WHO for bringing about this beautiful and important film festival, and congratulations to you.
Thank you, and thanks to all colleagues involved. You are a music composer with 3 Grammy Awards, winner of 3 Grammy Awards. You are also twice Goodwill Ambassador for the United Nations. You champion the rights of refugees with UNHCR and the environmental causes with UNCCD. And now you have been twice in our jury for this film festival, so you're so active man. I don't know how you manage.
Thank you so much, and thank you for making me a part of this.
I believe that with all the problems we face in our world, health, social, environmental, what is needed most is behavioral change. That's what you just said. And in fact, we are going to move now to other special mention from the jury. So we have to explore, but before that, we are going to explore that what Dr. Tedros, the Director General of the World Health Organization, announced last Friday to the journalists at the press conference of the WHO. Let's listen to Dr. Tedros.
The Health for All Film Festival brings a human face to WHO scientific work. Listening to the voices of people affected by health issues is a powerful way to raise awareness and improve our understanding of people's experiences. I congratulate in advance the winners and my thanks to the distinguished members of the jury. The award ceremony will be webcast on the WHO website, and we invite everyone to join.
Here we are live now. Dr. Tedros had to travel for an important meeting and is very sorry not to be with us. Before revealing the winning films, let's listen to Melissa Fleming, another prestigious jury member this year, since she is United Nations Under Secretary General in charge of global communication. I am really glad, Melissa, that you took the time to be with us in a busy schedule today. Please, what is your opening words for this ceremony?
Thank you so much, Gilles. And hello, everyone from UN headquarters in New York. Hello to the filmmakers, especially the creatives, the activists, cinephiles, and UN colleagues, and everyone joining in Geneva. and also all of you who are watching online from around the world. As a communicator myself, I really strongly believe in the power of storytelling to communicate complex issues, and the complex issue before us is health. Health is something that we all want, and health guidance is not easy to digest. So stories have a unique power to educate and also to move us to create change. And films are a really powerful medium for storytelling because they have visuals and they have sounds and they can capture our imagination and broaden our horizons. So that's why this initiative, Health for All Film Festival, is really, I think, innovative and important because it does highlight the real human stories on the front lines of the health impacts that people are experiencing all over the world. This film festival has also been successful, I'd like to point out, thanks to many UN agencies and offices joining WHO and that have amplified calls for contributions, for film contributions every year. So we had, such an incredible choice, a richness of choice. We've also had goodwill ambassadors of the UN Refugee Agency, or as members of the jury, as well as SDG advocates and ambassadors from other agencies. So I think obviously the support from the UN system has given this initiative importance, but it also shows that health is a huge priority for the United Nations as a whole, not just WHO. And we saw this so markedly with the COVID-19 pandemic. The third SDG, Sustainable Development Goal, emphasizes that ensuring healthy lives and promoting well-being is absolutely key to building prosperous societies. So I'm pleased to know that this initiative and all of its participants are working towards the achievement of Goal 3 of the SDGs. It has been such a pleasure and an honor to be on the jury in the better health and well-being category. And I got a chance to see so many insightful and creative short films. I have to say it was really, really difficult to make a choice. I'd like to congratulate all of you who were involved because all of the films were great. But of course, my biggest congratulations go to the winners. Thank you to Dr. Tedros, and thank you to you, Gilles, for organizing this wonderful festival. Let's enjoy the ceremony.
Thanks a lot, Melissa. And you see, the audience also appreciates your words, very kind words. Thank you very much for this encouragement. So we have to move on. The first category of our competition to be mentioned now is climate change and health. And indeed, it's a topic of concern for all sectors of the activities, not only in the United Nations, but throughout all actors in the civil society and all the policymakers, public and private. Ricky, you will come back with me to announce a special mention from the jury in this category. So it's not the prize, it's a special mention. I want to be clear because we have two levels, I would say, of awards. And we'll see now a short excerpt after your announcement to discover the prize winner. So it's going to be very short. So please tell us.
The special mention is indeed for a film that the jury really loved, in addition to the winner receiving the prize, and only one such mention can be made per category. For climate change and health, the special mention of the jury is attributed to Freedom to Breathe, A Child's Right to Breathe Clean Air, a short documentary by Georgette Thomas from the United Kingdom about asthma and other health consequences of air pollution among children. And Freedom to Breathe is an advocacy story made for several institutions at the global level.
Thank you. Let's watch the excerpt.
My name is Farron. I'm 10 years old. I have asthma, which is a condition against the lungs. When I've got older, I've realised it's the air around us and the pollution that's causing it.
Air pollution can damage your lungs and your heart. Your heart, and do you remember the third one that it can damage?
And your brain.
And your brain, absolutely. Excellent contribution, thank you.
Here it is. I am now with Dr. Francesco Branca, WHO's Director for Food Safety and Nutrition, who is also in our jury this year for the Better Health and Wellbeing category, in which you also jointly decided in this team to have to attribute a special mention in addition to the prize. So please, what is your announcement to the audience now? You can, I will handle the microphone if you want for you.
Thank you very much. It was great to be part of this group, and I really had the pleasure to be with Melissa Fleming, which you just heard from, and Sherry Silver for the deliberation of this category. Sherry Silver, for those of you who don't know her, is a well-known dance choreographer and activist for rural youth, also championing many health issues, and she will join us a bit later, I understand. So we decided to attribute a special mention to Love Shades, a short fiction produced and directed by Stephanie Stan from USA and Pratik Podel from Nepal. It's about depression. It's a very common condition, unfortunately, in the world, and it highlights the need for family caregivers to be able to see the subtleties of a mental health condition. So let's watch the excerpt. Thank you. Please. Thanks.
It's like another life for me right now, but it was a great time. This passage on the CBS
Voilà. So I am Ricky and Sylvie now together. I introduce Sylvie Briand. Please, Ricky, go ahead.
So I'm in the jury team of the Health Emergencies category with Dr. Sylvie Briand, WHO's Director for Epidemic and Pandemic Preparedness. Welcome, Sylvie, with us in this ceremony to announce a special mention in this category.
Thanks a lot. Ricky and I, we had the pleasure to be with Alfonso Herrera, a critically acclaimed actor from Mexico, who is also a UNHCR Goodwill Ambassador. The three of us decided to attribute a special mention to My Roots, Mayas During COVID-19, a short documentary directed by Angela Lucrecia Chiquin from Guatemala. It shows how vulnerable populations have been affected by the pandemic and the disastrous health and economic consequences of COVID-19. It also shows how the community managed to cope with the crisis. Let's watch an excerpt.
COVID-19 has tested Mayan solidarity like nothing before. This pandemic affects our family, our brothers, our people. After suffering a strong blow to our economy that was practically based on agriculture, we needed money. Inspired, many of us began to leave our villages and tried what was wrong.
Thank you for this winner. Thanks, Sylvie. We have now Petra Angel, connected remotely from our European WHO office. She is in the jury team for the very short film category with Lisa Smith and James Creswig, two colleagues from our regional offices. And they also decided about a special mention in this category. Isn't it, Petra?
Yes, and it was such a pleasure to be on the jury. The very short film special mention of the 4th edition of the Health for All Film Festival goes to Alexandra Mignin from France for her short film I Am Naked, Je suis nue. Félicitations. And internet can be an incredibly empowering experience, but at the same time, it can also be a platform for hate, crime, and assault. Revenge porn or image-based abuse doesn't concern only women, but, however, an overwhelming majority of the victims are in fact women. And this thought-provoking film showcases one of the modern forms of misogyny that we live with today. And it reminds us as well that it's not only about wielding power or about sexual online harassment, it's also about unspeakable emotional distress and the feeling of utter and total exposure. Congratulations for this powerful film and for highlighting this important issue. Let's watch an excerpt.
Je peux vous demander pourquoi vous n'êtes pas venu plus tôt?
Parce que j'avais honte.
C'est pas à vous d'avoir honte, c'est à lui.
The announcement of 4 special mentions being now done, with our congratulations to the producers and directors of those great films, we are going to stay with you, Petra, to start our series of awards to 7 winners. We'll proceed a bit differently for those prizes. We will see an excerpt of the film first, and a juror in each category will offer the trophy and make the announcement just after this excerpt. Are you ready to start on that, Petra, for the very short film prize?
I am. Let's watch an excerpt.
Good. So let's watch first the small portion of the film, and just after that, we will offer the trophy to the winner.
Vad håller du på med? Du är helt värdelös.
Du kan ju ingenting.
Du har inte, du har tappat det, fattar du eller?
Du är sämst. Du är ful också.
Du kommer aldrig fixa det. Du kommer fucka upp det.
Du är osmart. Helt otillräcklig.
So please, I welcome on stage Paul Gerndal. Do I pronounce your name correctly? Petra, I'm your hands. So you are part of this jury team. We listen to you. I am just, and I mute myself like in a mute movie.
Thank you, Gilles. Your excellent hands. And it's my pleasure to announce that the Very Short Film Prize of the 4th edition of the Health for All Film Festival is attributed to Paul Gerndal from Sweden for his short fiction film entitled Mirrors. Grattis, Paul. It's a strong story about mental health, about depression, about self-doubt, but also about finding your inner friend. Congratulations, Paul, for the prize. How do you feel?
I feel great. It's great to be here. Hi, everyone at home. It's an emotional moment, obviously. I think it's a big honor to receive this prize, but I think most of all and above all, the important thing here that is that we want to break down stigmas around mental health. We want to empower people to open up, and as you could see in the film, everybody can have feelings like this. So we want to empower people to feel that you should be ready to speak about how you feel, and you are not alone. That's the message here.
And Paul, this powerful film deals with what is often a very silent health problem in a personable way. And over the past few years with the pandemic restrictions, many people have found it harder than ever to find the support that they actually would need or want. And how do you plan to make this issue better known in your country and create impact?
Fantastic question. I think everyone thinks about that. Mental health is such a wide problem. I think the key is vulnerability. I think it's important that we, as friends, family members, if you're a teacher, if you're a classmate, if you teach a soccer team, that you show people that you can be vulnerable. Because that's so important to feel that you're not alone. And I think the concept of influencers, of famous people, like the people in the jury or musicians or the actors in the film, if they show that they can feel, they can experience anxiety, they can feel lonely, I think it's so important for the people who look up to them as role models. So let's continue to create art. That's one way of doing this. And I also want to empower everyone to seek help if you really feel alone. Yeah. Thank you so much.
The exchange. I offer you this trophy on behalf of the World Health Organization, and congratulations. I'm really glad that you had this prize. Thank you very much, Paul. And thanks a lot to both of you, Petra and Paul. And now let's move on to the next announcement. Thanks. Every year, we have two special prizes highlighting a specific health topics. In 23, one is dedicated to sexual and reproductive health and rights. This prize marks the 50th anniversary of the United Nations Special Program, HRP, which is led by Pascal Allotet, our WHO's director in this domain. Would you briefly tell us, Pascal, why this film prize is important for WHO and HRP?
WHO and HRP have, over the last 50 years, provided the space to develop the evidence for advancing our collective rights to the highest standards of sexual and reproductive health. It's been an absolute privilege to judge this prize along with Starling Mofokeng, the United Nations Special Rapporteur on the Right to Health, and Gareth Jones from the Sexual and Reproductive Health Service and Program at UNAIDS. We came to the deliberations with a shared commitment to sexual and reproductive health and rights, but slightly different perspectives. So we discussed gender, geography, global priorities, interdisciplinarity, health systems, not to mention age and intergenerational perspectives, creativity and emotion. It was so much fun, but it was really important and really sobering to recognize that the outcome of the prize actually came with responsibility. So this winning film has found and raised a voice on an issue that allows us to laugh, to think, and to feel, and critically, to be guided by the evidence.
Thanks, Pascal. Thank you very much for this background information. Let's watch now a small portion of this winning film before giving a trophy.
סקס זה משהו שמשתפר. אחרי כמה פעמים את תתרגלי ויהיה בסדר. שמעת שאמור להיות כואב בפעמים הראשונות. עובר זמן וזה לא משתנה. לא נעים לך אפילו בלתי נסבל. את מזדיינת ומבקשת להפסיק כל הצירה כזו. הרגשת רע. משהו לא בסדר בך. תמיד בבדיקות פתחת רגליים. כשהרופא נוגע לבדוק, צרב לך. וחשבת שאין קשר בין זה לבין יחסים. והתוצאות תמיד העידו. את בריאה, הכל תקין.
So, Pascal, who is the winner of this special prize?
The Special Film Prize on Sexual and Reproductive Health and Rights of the 4th edition of the Health for All Film Festival is attributed to Dina Steskovic from Israel for her short film entitled Volvo and Dynia, the story of a young woman with vulvodynia, and just to explain, it's painful intercourse, who struggles to obtain the care and respect that she needs. Dina, congratulations.
Thank you so much. Thank you. It's really an honor, so I'm really grateful. I'm Dina, I'm a creator and designer. I faced many challenges when I decided to make this film. I wanted to address a subject that is close to my heart and not widely known. About 18% of women suffer from pain during intercourse in different intensities. Vulvodynia is a family of syndromes that even those who suffer from them don't always know about them, while others feel ashamed because it's difficult, it's an intimate and personal topic. I chose to show a woman who shares a monologue bravely and openly because I believe that society needs to face and discuss important issues. I believe that as awareness of these different syndromes rises and they become normalized, people will know better how to support women who suffer from them. And most important, it will be easier for these women to accept themselves. I really want to thank my amazing team and all of the wonderful people who helped me make this film. Neta, Amber, Sharon, Alon, my parents, my family, my supportive friends and mentors for guiding me and participating whenever I needed. I'm so grateful for that. Thank you very much for the health organization, the festival organizers and the jury for giving me the opportunity to present the film here, for the exposure and the sharing. It's really an honor. I enjoyed making this short and I'm happy and proud you enjoyed watching it. So thank you very much for supporting my art. Thank you.
Thank you, Dina. You're amazing. Thank you.
Yes, and congratulations, Dina. Indeed, you see this prize. We are going to, so I hope one day we have all the winners like Paul being here in Geneva, but we are going to send that to you very soon after the ceremony. So this is your, yes, like that, you take it. It's kind of, that's a virtual ceremony, so everything is virtual. And since Pascal mentioned the other jurors, Dr. Tlaleng Mofokeng and Gareth Jones from UNAIDS, we are going to have a panel discussion with you and the other jurors in the coming weeks or couple of months, so to have more in-depth discussion. And that's one goal of the film festival, is to have more discussion with experts on the films. So please, let's be in touch about that. And everybody to stay tuned. So the other special focus in our 23 L4 Film Festival is climate change and health. And it's really a topic of great importance since we need to develop so many urgent solutions about the numerous challenges that global warming is revealing to all of us, anywhere in the world. Ricky is back with me to announce this special film prize. Since you are, Ricky, an environmentalist engaged to promote these solutions. We also have online Dr. Naima Algasser, who is in the jury team in this, for this prize, and she will make the announcement while you'll handle the trophy, Ricky, for the winner to receive this award. We also have in this team Sofia Kiani, a young activist on climate change, and Dr. Maria Nera, WHO's senior expert on environmental health. Naima, you are WHO's representative in Egypt. Would you tell us why you've been keen to join this jury team?
First of all, thank you very much, yes, for inviting me. I have been for the last 4 years following the Art Film Festival. It's a dream to come true. I have been since childhood working on different forms. I am not an artist, I'm not a filmmaker, not a scenarist, but a believer. As a believer, as a child, age of 7, celebrating World Health Day, then it was about environment and sanitation. I will not say how many decades ago, but it made in me on how can we bring change of behavior through arts, and not only films, but also theater and paintings. This has really come to me, and I implemented it in my work, various countries with youth and also with different countries in violence, such as Iraq. Sudan was my posting prior to Egypt, where we used short films to bring a behavioral change. So that's one thing that brought me to initially just be a screener, a reviewer. And I'm very, very, very honored that today I am being also selected to be a juror. As I said, this has been a great belief in Health for All. It's my belief that through art, we are really fulfilling the definition of health, mentally, psychologically, spiritually, besides physically, and without any exception. This has been a path, and I'm very proud that as WHO, we have really reached to a stage to really have health and art has had this experience. Initially, I was seeing I'm playing instead of delivering. We always delivered, but through different means. And now today, with the 4th version of the film festival, I'm honored to be also selected as a juror and be part of this distinguished team Oh, and I would really like to also say one thing. Congratulations for everyone who has really been part of this team since 2020. Thank you.
Naima, thanks a lot. Let's watch now a small portion of this winning film, and then you will make the declaration about the winner.
But how does climate change add to gender-based violence? Yes, let's talk about that. Due to increasing desertification and decreasing resources, women now walk farther to fetch water and fuel wood. Longer and dangerous journeys mean they are increasingly at the risk of being raped. This is particularly the case with women in Global South.
Yes. So, Naima,
yes.
Please, do you have a text to announce?
It's my honor. Yes?
Go ahead.
I would like to announce the film that won the prize of climate change and health category under the Health for All is When Climate Change Turns Violence. When Climate Change Turns Violence. Congratulations to the winner. And I would like to Goodwill Ambassador of UNHCR, Ricky, who is my partner, to announce it.
The winner is Vandita Saria. A big round of applause.
Thank you. Good evening, everybody, and thank you so much. I am extremely delighted and grateful for this opportunity and for this recognition. The film was born out of a desperate need to address an intersection of issues, which is I'm glad that I was able to do that, and I'm glad that I was able to communicate it well, and that it was found worthy enough to be awarded tonight. Thank you so much again.
Thank you.
Congratulations,
thank you,
Vandita.
And congratulations.
Yeah, thank you. I think Ricky will make this final comment on this segment.
Congratulations, Vandita, and I'm really glad that a winner from India is in this 2023 edition. We receive so many stories every year from India in the WHO's Film Festival, and I hope that this will continue for the next edition. The topic of your film is very close to my heart as the United Nations Goodwill Ambassador on environmental issues with the UNCCD, and it highlights a health consequence of climate change that most of the time we wouldn't even think about or even imagine that it could be true. So thank you for the spotlight you have put on this challenge, and let's move to the next prize.
Yes, thank you. Oh, please,
Vandita. Just to say, link of people's health, women's health, and the environment. You have done wonderful, Benedetta, in actually linking gender-based violence. 1 in every 3 women is actually subjected to the violence, and linking it to the desertification and climate change. And we are very pleased to you. Thank you, Ricky. I'm sorry I took the floor because you said environment, and I'm linking the women's health. Thank you very much.
Thank you.
Thanks a lot to both of you. That was a great moment. And again, I repeat, we're going to have a special programs after the ceremony to develop more this goal of health education, health promotion through film, and hopefully health impact benefiting directly to some populations. And your film is also very educative in this respect. Every year, we also have a special prize for a film made by students. It's a way to mobilize universities around the world and youth organizations to encourage them to tell their stories about health. It's a prize attributed from all the other categories. There's not a specific list for them. So that's quite an interesting aspect or original aspect of our film festival, to mix in the same competition films made by students, by good amateurs in filmmaking, sometimes by health professionals themselves, and by professional producers and film directors. It's quite unique, I think, in the world of film festivals. Let's watch an excerpt of a film by a student which obtained the best score from all our jury teams. Glad you have your applause of a room here. The special prize for a film on health made by students of the 4th edition of the Health for All Film Festival is attributed to Su Yun Hong from Germany for her animation film Gasping for Life. It's a film about addiction on screens and mental health consequences of such addiction, including anxiety and depression. Congratulations, Su Young Hong, sorry for my pronunciation, for your prize.
Thank you very much. Your pronunciation was perfect. I'm sorry if the audio is lacking because I'm at a conference right now and it's been messing all day. So first and foremost, I would like to express my deepest gratitude to each and every one of you, especially my amazing team members of the International Pharmaceutical Students Federation, Sura, my creative director, Esta, my music producer, who were high school students of mine, and of course my family who supported me throughout this whole meaningful journey. And without the support and the encouragement, none of this would have been possible. Also, I would like to extend my heartfelt thanks to the WHO to create such a powerful platform, also for youth to bridge the gap between science and art, and to reach people on a more personal and more deeper level. We started with 0 budgets and 10 days till the deadline, like all good students, and look where we are. I can say that I'm just proud. To tell you shortly about the backstory of this short film, I actually created this movie for my younger brother, who is going through a rough time right now, and who actually dubbed the main character here. And he told me to forward his greatest thanks to the WHO for creating the opportunity to amplify the voices of those who, like him, are struggling right now. And I felt just like young people's voices are often neglected and overheard when it comes to mental health disorders among adolescents. And the main message of Gasping for Life, and I think it applies to everyone, is we are here for you and you're too valuable and too precious to let go.
Sue, thank you very much. Okay, sorry. I'm sorry, the audio is not so good from your location. Thank you very much. And, you know, we have to move on many prizes. I want to convey also to you the appreciation of the jury who really found your animation so well illustrated as it places the audience in the mind of a character. It's one of the powers of animation for films about health. It helps to show things that cannot easily be shown with real images. And that's what your film does. My question is about also your source of inspiration, but could you just very quickly tell us if you get inspired on this story of screen addiction because you witness that so much a lot around you? Just quickly, in one sentence, please.
Okay, so I'm actually a pharmacy student, so I do a lot of I'm a public health advocacy coordinator, so I actually do value a lot about public health, about young people's affection and what's going on for young people's lives in general. So I think social media in general has a lot of impact on the mental health.
Okay, congratulations again, Su Young Hong. And the audience is appreciating. And stay tuned. Stay tuned until the end of the ceremony, since Sharon Stone will speak about mental health in films. And your creation is a great illustration of what she calls for in her message. She calls for that among many other types of films which could be made, of course, on the topic. So now I have Sylvie Briand. You announced earlier a special mention from the jury in the health emergencies category. And you are back with Ricky and me to announce now the Grand Prix for this category. So we have a series of 3 Grand Prix. You start with this one, which is among the regular prizes we give every year. And we use Grand Prix because in English because to have a little bit of a French touch. I'm sure you appreciate the French touch. In 1 minute, you will offer a trophy to the winner. I think Ricky will handle that. It's a heavy trophy, don't you feel? It's kind of... And I'm pleased to introduce as well Amanda Fenn, a colleague from Brazil working in WHO's Chief Nurse Office. Welcome, Amanda. So we are a big crowd here. And you will understand, the suspense won't be much longer, why Amanda is with us. You will help our 2 jurors with the winner in a minute. But let's watch first an excerpt of the film.
Foi bem difícil porque nos primeiros dias a gente não tinha leite suficiente, estava super lotado. A gente não tinha hospital de campanha prontos e os que estavam prontos não tinham equipe. E aí eu vi um paciente morrer agonizando na frente da gente. E eu sabia que se a gente tivesse uma saúde eficaz e de qualidade, essa pessoa poderia estar viva. E essa é a realidade que a gente vivenciou todos os dias.
So, the Grand Prix for a film on health emergency of the 4th edition of the Health for All Film Festival is attributed to Clim Publicidade and the institution Federal Council of Nurses, COFEN, from Brazil, for their documentary Nurses Facing COVID. Congratulations.
Bom dia, boa tarde, boa noite.
Greetings, everyone. It's an honor to be here.
A todos que acompanham a cerimônia de premiação da 4ª edição do Festival de Filmes Saúde para Todos.
For all that are here watching this award ceremony.
É uma grande honra receber este prêmio.
It's a great honor to receive this award.
Em nome do Conselho Federal de Enfermagem do Brasil e da Clint Publicidade.
On behalf of the Brazilian Federal Council of Nurses and the Clint Publicity.
E agradeço imensamente ao júri pela escolha do nosso trabalho como vencedor nesta categoria.
A huge thank you to the jury for selecting our video as the winner of this category.
O documentário Na Linha de Frente mostra a dura realidade.
The documentary Nurses Facing COVID showing a harsh reality
enfrentada pela enfermagem brasileira na pandemia da Covid-19.
Faced by Brazilian nursing during the COVID-19 pandemic.
Com a chegada do vírus, precisamos conciliar a falta de equipamentos a uma alta demanda de trabalho em UTIs e enfermarias.
When COVID-19 arrived, we had to deal with the lack of equipment and high demand in ICUs and clinical wards.
Como resultado, a pandemia mostrou
As a result, the pandemic showed
a importância da enfermagem e impulsionou nossa luta por valorização.
the importance of nursing and boosted our fight for recognition.
E pela aprovação de uma lei que estabelece pela primeira vez no Brasil o piso salarial para toda categoria.
And the approval of the first law in Brazil that established the national minimum salary for the entire category.
Por outro lado, este colapso sanitário
On the other hand, the public health collapse
fez com que o Brasil registrasse o maior número de óbitos entre os profissionais de enfermagem em todo o mundo.
made Brazil the country with the highest number of deaths among nursing professionals in the world.
Este documentário é uma homenagem
This documentary is a tribute
aos profissionais que não mediram esforços
to health and care workers who spared no effort
para cuidar da sociedade brasileira
to take care of the Brazilian society
durante uma crise sem precedentes.
during an unprecedented crisis.
Este prêmio é o reconhecimento do nosso protagonismo
This award is a recognition of our protagonism,
e o dedico a toda a enfermagem,
and I dedicate it to all nurses colleagues,
a todos aqueles que nos assistem,
to all those who are watching us,
de onde estiverem,
wherever you are,
nos valorizem,
recognize us,
pois sem enfermagem
because without nursing,
não se faz saúde.
there is no health.
Muito obrigada.
Thank you very much.
So huge congratulations, Betania. And thank you so much for this really moving movie. And I would like now to give the floor to Ricky to give the last words.
Olá, Silvia. É grande prazer estar falando com você.
Olá, Betânia. Desculpa te interromper. Nós vamos passar agora para os comentários finais do Rick em agradecimento, ok? Obrigada.
Nurses Facing COVID is a very powerful documentary about the challenges faced by public healthcare professionals in Brazil, not just on a professional level, but also on a human level over the course of the pandemic. The story resonates with me and, of course, globally, and showcases the importance of having a robust and affordable healthcare sector to deal with a crisis of any kind. So congratulations.
Parabéns, Betânia.
Thank you very much. Thank you to the three of you. That was great. And congratulations on my behalf and on behalf of WHO for this Grand Prix. We have to move now to the next one on Better Health and Wellbeing category with Dr. Francesco Branca. It's your turn to be back here and to announce. But as we did before, we are going to see first an excerpt. And maybe you would like to give a word of introduction to this prize.
So we're going to...
sorry, I didn't give you a microphone to you.
So this is going to be the Grand Prix for a film on better health and well-being, a category gathering stories on determinants of health, social, environmental determinants, including issues on nutrition, physical activity, gender, and other aspects that are affecting the well-being and not only the absence of disease. So health is defined like this in the WHO Constitution, and it's really covering a lot of aspects in our life. And it's my pleasure to introduce now Sherry Silver. I mentioned before, one of my co-jurors for this category. We deliberated together with her and Melissa Fleming, who intervened during the opening of the ceremony. Sherry is a well-known dance choreographer and WHO's champion for physical activity. Welcome, Sherry.
Hi, thank you. It's a pleasure to be here. It's a pleasure to be here. Thank you for having me. It's such an honor to be a part of this. And let's watch an excerpt from the film, the winning film.
ফ্যাক্টরি আসার আগে এটার ও লেখাপড়া করতে পারতো সাইম, ও মনে রাখতে পারতো। তারপর পরীক্ষা দিয়ে ক্লাস 1-এ উঠলো, 1-এ উঠেও ভালোই রইলো। তারপর আস্তে আস্তে সব কিছু গুলিয়ে ফেলাইলো। এইটাই আমি বুঝতেছি এখন যে এই শিশার কারণেই মনে হয়।
তুমি কোন ক্লাসে পড়ো? ক্লাস 2-তে? কোন স্কুলে?
রাজাবাড়ি।
আর স্কুলে তোমার বন্ধু বান্ধব কারা?
মিম আর অনেক আছে।
ও মিম তোমার স্কুলেই পড়ে?
হ্যাঁ,
আমার ক্লাসে?
হ্যাঁ।
কোন ক্লাসে?
3।
ও মিম 3-তে পড়ে?
ও তো 3-তে পড়ে, আমি 3-তে পড়ি।
তুমিও 3-তে পড়ো?
হ্যাঁ।
তুমি একটু আগে বললে তুমি ক্লাস 2-তে পড়ো?
মনে নাই।
মনে নাই?
So the Grand Prix for a film on better health and well-being of the 4th edition of the Health for All Film Festival is attributed to Mitali Das and Arifur Rahman from Bangladesh for their documentary 1 in 36 million, Story of Childhood Lead Poisoning in Bangladesh. This is a story about environmental health that they made for the NGO Pure Earth in Bangladesh. Congratulations again. And here's Mitali and Arifur.
It's our great honor that our film 1 in 36 million has been selected as the winner in the Better Health and Wellbeing category. I want to thank World Health Organization and the Health for All Film Festivals organizers jury board, and everyone who worked very hard to put this festival together and for selecting our film as the winner. About 36 million children are poisoned by lead in Bangladesh, and this causes brain damage, decreases IQ, and creates behavioral problems. So this recognition will help us to draw more attention on the childhood lead poisoning issue, to create more mass awareness, and also influence government and decision makers to make lead pollution a priority, to take immediate actions. It's difficult to portray the impact of lead pollution as it is an invisible poison, but this story helped to give that visibility and also showcase that how childhood lead poisoning can impact a whole family in so many layers, in socially, mentally, and economically. And we don't want any more child like Saim to suffer through lead poisoning, and we urge to stop informal recycling of used lead acid battery and invest and take action to identify the sources of lead, which is imperative to solve lead pollution. This film was produced by Pure Art with the support of the film crews of Gopi Bagha Productions Limited. I want to thank Arif, cinematographer Shohag, Bappi, editor Sam, Shubho, Partho, and our creative supervisor Angela. Without all of them, this film would not have been possible. Again, thank you everyone. Let's solve lead pollution and save lives and protect the planet. And I will also would like to request Arif to say a few words.
Hi everyone, thank you so much. And I don't want to, linger this conversation, but I just wanted to tell. I tried to capture the mother's and the son's emotions. And ironically, during that time, my wife was also pregnant, and now I have a baby girl who is like 18 months. So I can resonate actually, what is the situation when we witness our child are affected by all the pollutions throughout the world. Thank you so much, everyone. Thanks for trusting us, and thanks Mithali, Angela, because this was really unusual storytelling. Usually in Bangladesh, all the development documentary, it's like talking head documentary. So this was really like a brave steps from them. Thank you, everyone. Thank you so much.
And now, Sherry Silver, would you please give your comment to our winners from since you are in this jury team with Melissa Fleming and Francisco Branca?
Yes, it was a pleasure to be a part of this team. I think I have the coolest jury team. We chose this film because it's very informative, it's personal, and it's captivating, which made it easy to connect with. And, these issues are very important because we need to prevent these environmental hazards for children, because children, all people, but children are more at risk because of their young bodies being so vulnerable. Even from conception, I think this is something that the film even made me more aware of, is that just from conception, children are at risk simply by the mother breathing in toxic air. So I felt like the film brought a lot of awareness. And what makes these hazards even more frightening is that a lot of them are invisible. And for example, in the film, with the batteries and the pollution in the air. And personally, this is very close to my heart as United Nations IFAD advocate for rural youths, because these environmental factors affect the food that we eat as well, and they can thus enter the body. So I just want to say, well done, guys. You did an amazing job. The quality was great as well.
Thank you, Sherry, for sharing this feedback from the jury. Francesco, would you conclude on this prize, please?
Yes, I think you've highlighted a reality through a family. The life of Shona and his children, her children, were affected against their will. The air, the water, the food around them. But the lesson is that there's something you can do about it. Health authorities, civil society, government authorities can, first of all, identify the issue, and then they can act on it and prevent many more from being affected. So this is a story of one family, but it's a story that affects many people in Bangladesh and many people in the world, and it gives us a reason to work even more in public health. So thank you again.
Thank you, and you will receive this trophy very soon, as possible. Congratulations again. This is now the time for the last announcement, but certainly not the least, since it is for a film on universal health coverage, another key global public health goal for WHO that WHO has fixed as a priority in its program of work. The jury team for this regular category in our film festival is composed of Sharon Stone, critically acclaimed actress, who will speak in the conclusion, as I mentioned earlier, and she has deliberated with Adele Onyango, a champion in Africa of empowerment of women and youth, and also with Dr. Sosefal, WHO's director of neglected tropical diseases, activities and guidelines. As Adele and Sose were unfortunately not available today, I have invited Dr. Alarcos Cieza. Welcome, Alarcos. Thank you for being with us. You are the WHO expert on rehabilitation. You were in the jury last year for a special prize on rehabilitation, so you're used to the exercise now. And her presence here already gives a little clue, because she's an expert on rehabilitation, about the topic of a winning film. But let's see an excerpt first.
I won't see that picking in my heart boil. I be the imagine how this picking will able to map. It will able to map straight. Because you know, black man, something good or bad or when they begin to work in mama. I say you don't go. They will be end and the woman be distressed if I.
After the war, Sierra Leone developed a network of physical rehabilitation centers open to everyone that needs treatment.
Making 5-9, my brother called me, said, oh, you're in a radio, say, solution there for them picking there, for cancer body. We say, I'll be there, wait, tell me that one day, I'll be glad.
Announcement, please.
Yeah, thank you. And I think now that you have said that I was not in the jury, no one can say that I was biased towards rehabilitation. So it was really a very neutral decision. And the 4th edition of the Health for All Festival, the Grand Prix on Universal Health Coverage, is attributed to Mami Hanisa Raminosoa and Nanta Nainina Rokoton Dranivo. Congratulations.
From Madagascar. And that's for which film?
And the film is called Jonathan's Miracle Fit. And it is a film that it was filmed in Sierra Leone. And it is really a strong story about clubfoot, about disability, and really most importantly about the benefits of rehabilitation. And this has been really thanks to the work of the government of the Sierra Leone, but also of an NGO called Miracle Fit. So congratulations to Mami Hassanina and Nante Naina.
And congratulations to you for pronouncing their names.
Yeah. So great that you are with us. Huh? Fantastic. So tell us what this film means to you and also what this prize means to you, please.
So thanks a lot for the prize. This is incredible for us, such a great honor. So this film holds great significance for us as filmmakers from Madagascar, representing Africa, because at DDC Africa, we strongly believe that local stories are better told by local filmmakers while using a universal storytelling approach that makes those stories relatable to everyone. And that's precisely how this short film came to be. Miracle Fit, the NGO, placed complete trust on us. They gave us the freedom to guide the process, to research and discover the most captivating story and infuse it with our cultural perspective. So this recognition today highlights the importance of this approach. Also, making films for health, films for development in general, is a mission in itself. Clubfoot is a birth condition that is still under-recognized. It deserves greater attention and investment. So winning this award, I think we feel like we can contribute directly to restoring more feet of babies. But moreover, that would also help bring peace of mind to their mothers. It would restore the dignities of their families and spark some hope on their hearts. So thanks a lot.
This is all really what this film has done, but I want to tell you something else, because what this film also really does is to show very clearly the impact or the life-changing impact that rehabilitation can have. Also abolish or address many of the misconceptions of rehabilitation, because very often it is understood that rehabilitation is very expensive. It comes after treatment without realizing that is really rehabilitation is the treatment, and also emphasize how much can change when countries commit to integrate rehabilitation in health services. And it is very timely because this year, 2 weeks ago at the World Health Assembly, a World Health Assembly on rehabilitation was endorsed by all 194 member states in WHO. And this was the first time ever, it is an historic resolution because of that, because it was the first time ever that member states have endorsed a resolution on rehabilitation. So you have put a motion and really a story to that what this political commitment that member states has made in this resolution. So thank you, the film is amazing.
Thank you, Alarcos. Congratulations again to you. Here is your prize. It's coming soon to your by post office, crossing the oceans for you. And I want to make a linkage here because we have done the 3 Grand Prix now, we have gone through them, and we have had, in all these topics that we are mentioning, especially nurses facing COVID from Brazil, but also when we speak about rehabilitation, or even when we speak about health promotion, category of health workers who are almost always there are the nurses. And we have, since we have Amanda who joined us before, I would like you, Amanda, to make an announcement about, since this year is also the 75th anniversary of the WHO, and it's an occasion for the WHO to develop many new things. The Film Festival is a young creation of the WHO, only 4 years ago, but you have a new one, brand new announcement to make linked to the nurses. And since I mentioned we're going to have a panel discussion about nurses, please tell us what it would be about.
Wow, thank you so much. It's really nice to be here and really nice to be back. Just to make this announcement, as Jos was saying, as part of the WHO initiatives takes this year on the occasion of the 75th anniversary of WHO, a new campaign has been launched here. And it is dedicated to train nurses and midwives at the country level in basic emergency care. So we all know, and we all have been seeing here, that health emergencies happen every day, everywhere. So, and we also know that emergency care providers, they save lives. So we are here to invite you to join us in this important initiative and support the nurses and midwives globally. Thank you so much.
You're welcome, thank you. And it's one of many. Thanks a lot. It's one of many innovations that the WHO is developing, and as Alarcos mentioned, the films we select in this film festival are also a way to illustrate many of the guidelines and resolutions taken at the World Health Assembly and so on. So all prizes of the 4th edition of the Health for Film Festival are now announced. It is hopefully the start of many health education activities using these winning films, as well as those from our previous editions, and even the great stories in our official selection of films, which haven't won a prize today, but are all very valuable. We already have for 23 several events planned to highlight again those stories and topics. For instance, in November, in the Netherlands, a special screening program will take place at the Global Conference on Health, jointly with the WHO's Healthy Cities Network meeting happening in the same location. Please visit regularly our Film Festival website, where everything will be announced. You can also join on LinkedIn our group of advocates dedicated to this health impact through film goal and share there your thoughts and experiences about that. The link is also at the bottom of the festival webpage. Before we listen to Sharon Stone for her conclusion, I would like to thank all the jurors in this festival, who in the room and those remote, for their great dedication to the festival. And a special huge thank you to hundreds of colleagues who have helped every year for this festival implementation and its promotion. A lot of them are in the room today, so thank you to all of you, and you can applaud yourself. And the same thanks for many NGOs and WHO partners, including many UN agencies, it has been mentioned earlier by Melissa Fleming, and programs also helping for making every year our call for short films better known. And a warm thank you to my colleague, Natalie Carminati, our film festival consultant, who has worked hard to prepare this ceremony with all of us. Thank you. The next call will be launched next November, so stay tuned for that if you have a story to tell about health. And now is the conclusion by Sharon Stone that she recorded for the Cannes Festival in France, where we had the chance to be invited last month for a discussion about mental health in feature films and in the film industry. Goodbye, and let's keep in touch.
This year, there were an extreme lean in these documentaries towards the subject of mental health. It was so clear that the consideration was made because 1 in 8 persons in the world is living with a mental health condition. I think that we have seen through our own personal conditions, from the COVID crisis and moving forward, now we have had much more intimate contact with ourselves and others. We've experienced a crisis together as a world. And we understand that with 1 in 8 persons having a mental health crisis, that we all know someone having a mental health crisis. And we have to start talking about what that means in terms of insurance, in terms of discussing it as a common thing. And what I think is that we have to look at how powerful movies can become for raising awareness about mental health conditions, which are increasing around the world according to the World Health Organization. We have to look about how important universal health coverage is. It is critical for these people in need. So we have to look not only to the health sector to work on this, but it requires a multi-sectional approach in terms of prevention and promotion. And why not having the domain of artistic creation, entertainment, both feature and documentary film production, easy for me to say, but not hard for us to do. Why not have the artistic endeavors of our film community, our television community, our documentary people, our feature film people, and certainly our international television community involved to deliver the appropriate message and, more importantly, the global cultural references that this is not a personal problem. This is not a problem to be ashamed of. This is a problem that 1 in 8 people, got it, around the globe. That's someone in your family. It's your friend. It's your coworker. We need this help. Let's give it in our film community. I'm Sharon Stone. I work for the World Health Organization as a juror on these films. Thank you for your consideration.